So we have another miracle case. Very exciting. We've been 4 for 4 on our diabetics so far, getting them type 1 diabetics to produce insulin again. Type 2 diabetics, pretty darn simple stuff. I mean, that just should be able to knock that out with everybody. It's not a big deal. We just need to figure out why their blood sugar continues to stay high and help with their insulin sensitivity. But type 1 diabetics, theoretically that's impossible. Again, we're 4 for 4. We have one that I'm working with right now, a young woman in her early 30s. I think she's 30. She had no insulin. She hasn't had insulin for at least 25 years. And she's completely insulin dependent diabetic. She's super healthy, but she's following everything that we're telling her to do. And after a month, unfortunately, she still had no insulin production, no C-peptide, meaning her pancreas can't produce insulin, less than 0.1. It was a really hard day for us because she's doing everything I'm asking for. She's investing all the money. She's eating everything appropriately. She's doing IVs. She's doing everything that I want her to do specific to her condition. We've done all the big labs. I can tell you exactly why she has it. And after 1 month, there was still less than 0.1 on her C-peptide, which is heartbreaking for me. It's heartbreaking for her. Because she, in her mind, she's jumping with faith, but going, I don't think there's any way to ever get insulin back. I'm going to try this, but there's probably no way I'm ever going to get insulin again or make it from my own body. So about a month and a half later, I'm doing a case management, I'm talking to her, seeing how she's doing, and she's following everything perfectly. She feels great. She's actually taking a little less insulin, maybe because her diet's so clean. So we drew a lab the week before because I wanted to see how her white blood cells were doing. And we got the wrong lab. Unfortunately, we drew a C-peptide. But fortunately, we drew that C-peptide because we found out actually she's making insulin. So about 2.5 months into her process with me, she's now got a 0.21 on her C-peptide. 0.8 is normal. She was less than 0.1 and always been less than 0.1. She doesn't produce insulin. Now she's producing 0.21. It was such an emotional and amazing event. There was a lot of tears. I might have had allergies. I don't know what was going on during that time, but it was amazing and it was a great day. There was actually a lot of really neat things. We have a metastatic bone cancer patient who had some amazing things happen yesterday as well. And we had a person that traveled up from another state. That worked out really, really well as well. And he relatively very disabled individual. But yesterday was an amazing day, and that type 1 diabetic was mind-blowing. It was an amazing experience, and I just want you all to know, you don't have to be sick the rest of your life, no matter what condition you've been diagnosed with. The medical model is, I'm going to give you a drug the rest of your life. You'll just always have this. If we figure out the root cause and we actually treat it, things typically go away, and it's not normal to have a chronic disease. That's common for the Western world, where we depend on drugs to take care of our problems. But there's many parts of the world where people just eat a really clean, unprocessed diet. They're outside all the time. They exercise constantly. They believe, they have a strong belief, or they have a purpose in life, and they are relatively free of all chronic disease. It is not normal to be as sick as we are. We are the sickest species that has ever walked the planet. And if you figure out the root cause and you take care of yourself, you will have to change things. Chances are you don't have to be sick forever. You guys have an awesome day. Feel free to like, comment, and share. We'll talk soon.